Should the NHS ask patients what their preferred method of communication is? Do we at the moment? I don't think so. I was having an interesting conversation with someone this week around DNAs and why people DNA and what we could do. And they asked me the question, do you ask people what their preferred method of communication is? And I was like, no. They said, well, what do you do? Well, we either send them a letter, we try and ring them, or we send them a text message. But we don't ask people what their preferred method of communication is. We've never done that. I guess the question is, should we? Do we all have the same preferred method of communication? Some people quite like text messages. Some people may prefer email. Some people may prefer a phone call. Or some people may prefer a letter. We never ask what they prefer. We just make the assumption and we do it how we want to do it. Now, I appreciate that for sending emails there are some IG issues, and there would need to be some looking into that side of things. But I guess the question is, should we, as the NHS, or should the NHS, ask the patient when being referred in what their preferred method of communication is? And I guess the second question is, do we need to ask them what language they want the communication in? Because I think in most cases a text message is in English, a letter is in English, and a phone call is normally in English. What about those people who really don't speak English, and how do we communicate with them? If we send a text message to someone who's Polish, is it easier to send the text message in Polish? Will we get a better response? Will it improve our communication with our patients, or with the NHS patients? And will it improve or reduce the DNA rate if we did that? Something to think about. And I guess the question is, what is your preferred method of communication? If the NHS were going to send you an appointment or ring you up to book an appointment, how would you prefer them contact you? Have a think about it.